Healthcare IoT Security by Anupam Murukirthi. What is Healthcare IoT, or the Internet of Medical Things, IoMT? These technologies are in reference to the interconnected network of medical devices and applications. These devices and applications collect, transmit, and share health-related data over a network. Some at-home devices can include smartwatches, glucose monitors, and heart rate monitors. Some hospital devices can include smart IV pumps, insulin pumps, infusion pumps, and pacemakers. Interest in healthcare IoMT security. My interest in IoMT security stemmed from my experience in healthcare IT. I realized that healthcare technologies involve more than just information technology. IoMT offers numerous benefits through AI and dynamic adjustability. However, these devices need to be secured, especially where hacking can lead to casualties in life and death situations. Topics for this presentation include historical background, current trends, human impacts, recommendations, and new findings. An interesting quote I found through my research is that in 2026, the number of Internet of Things IoT mobile connections worldwide will more than double from 2021. This is in relation to all industries, including healthcare. Historical context. During the late 20th century, the healthcare industry started integrating information technology in the form of electronic health records, or EHRs. This streamlined management and enhanced data accessibility for healthcare professionals. In the 21st century, there has been a paradigm shift from episodic care to continuous and personalized care with the development of different smart sensors that are capable of proactively monitoring vital signs and chronic conditions. These IoMT smart sensors have improved patient outcomes and reduced costs by allowing remote patient monitoring. They also allow healthcare professionals to make informed decisions and also allow patients to advocate for their own health. Current trends, technical and ethical. There are many trends that are seeking to be common practice in IoMT standards. Interoperability can allow for the seamless exchange and integration of data amongst various healthcare systems and devices. This can allow for medical devices to report data straight into a patient's chart. It can also allow multiple medical devices to collaboratively interact and change parameters on the fly through the use of artificial intelligence or AI. AI can help identify and analyze different conditions like cancers and heart disease through the analysis of different data like vitals and images. Standardized security can allow a proactive approach to mitigate against potential vulnerabilities and attacks using mechanisms like zero trust security. Zero trust architecture prevents unauthorized access to data and makes access controls as fine-tuned as possible. This ensures that trust is established based on ongoing authentication without any predefined assumptions. Positive human impacts. IoMT provides many positive human impacts. Proactive monitoring and alerting allows healthcare providers to intervene promptly when abnormalities or potential issues are detected. Examples of data that professionals can monitor include heart rate, blood pressure, and oxygen levels. Dynamic adjustments can be made by healthcare professionals to make informed decisions about treatment plans, like adjusting medication dosages or even recommending lifestyle changes. Enhanced data accuracy and accessibility can be achieved by IoMT. It can be ensured that data is accurate and readily available. This reduces human error and creates centralized data repositories where data can be shared amongst different providers or departments to enhance collaboration and overall efficiency. Negative human impacts. Even though IoMT has many positives, there are also some challenges in regards to negative human impacts. Vulnerability to hacking is a significant concern. These devices are connected to networks and databases and are potential targets for cyber attacks. The interconnected nature of IoMT devices introduces severe consequences in the event of cyber attacks. Infusion pumps make up over half of IoMT devices, and interference with these devices may result in disruption of essential life support, leading to casualties. Data accuracy and reliability challenges are also seeking to be resolved through the use of IoMT devices. However, these devices are not immune to technical glitches and malfunctions. These reliability issues may impact healthcare professionals in their willingness to fully rely on these systems for critical decision making. New findings. There are multiple ways to keep IoMT devices protected and secure. Collaborative research and information sharing is a growing approach to identify and address vulnerabilities in IoT devices. Further analysis of vulnerabilities can help organizations create better frameworks to keep information secure and create more robust defense against evolving cybersecurity threats. Policy advocacy ensures that regulatory frameworks are being built and are responsive to the dynamic nature of cybersecurity threats. The U.S. government is advocating for an initiative to increase cybersecurity for IoT devices. Recommendations. Based on my knowledge and research, I have some recommendations for the healthcare industry to improve security of their systems. Continuous monitoring and adaptive security can assess security posture of devices in real time to allow detection of vulnerabilities without requiring devices to be taken out of production. Collaborative regulatory frameworks can allow manufacturers to facilitate efficient and timely approval of security updates for healthcare IoT devices. This fosters a relationship that allows manufacturers the ability to swiftly respond to emerging threats while adhering to regulatory requirements. Resource-efficient strategies can allow for device replacement and updates which can greatly improve security. This may include phased deployments of updates to minimize disruption, prioritize critical devices for immediate attention, and exploring cost-effective alternatives for maintaining a pool of spare equipment. Here are the references for this presentation. Thank you for watching my presentation. I enjoyed researching IoMT security and learned a lot of useful information for my future in healthcare cybersecurity.